Hey guys, it's Erica with Aetna Better Health of Kentucky. Here at Aetna Better Health of Kentucky, we have a set of free classes that we offer to young adults who are preparing to transition into adulthood. So it is my pleasure today to talk to you about health insurance. I know. It sounds a bit dull, right? But trust me, by the end of this training, you're going to feel a lot more confident and empowered when it comes to choosing the right health insurance for you. We're going to break it all down, and I promise we're going to keep it fun and easy to understand. A lot of people think health insurance, is something very complicated and maybe even a little bit scary. But here's the truth. It's actually one of the most important things you can have as an adult. So whether you're healthy, you're getting older, or you're starting a family, health insurance has your back when things go wrong. And guess what? It's not as hard to understand as you might think. So what is health insurance? I think that's a good place to start. Well, health insurance is a type of insurance that helps cover the cost of medical expenses, and it's designed to help protect you from the high cost of health care by paying for some or all of your medical bills. So when you have health insurance, you share the financial burden of medical care with the insurance company, so you don't have to pay everything out of pocket. Health insurance is a way to help manage the costs of health care. It protects you from high medical bills. It helps cover doctor visits and prescriptions and surgeries and other medical expenses, and can really provide access to a range of health services. First, let's talk about why is it even important. Picture this. You're out with your friends, you're having a great time, and then bam, you twist your ankle. It's swollen, you can barely walk, and you're like, great, this is going to cost me a fortune to get this fixed. Well, without health insurance, that simple visit to the doctor or to the emergency room, that could cost hundreds, even thousands of dollars, depending on what kind of treatment you needed. Insurance protects you from those huge medical bills, and it helps you get the care that you need without going broke. So it's not just for emergencies though, it also covers routine checkups, prescriptions, mental health support, and even preventive care like vaccines or screenings. So now that we've talked about why it's important, let's talk about some of the costs that are involved. It's not just about how much you pay for insurance, but how much you pay when you actually use it. So there are three main things you're going to want to keep in mind: premiums, copays, and deductibles. The premium is the monthly amount you pay for your insurance. So think of it like your subscription to healthcare. So instead of paying for Netflix and watching TV shows, you're getting access to doctors and prescriptions and hospital visits. And your premium may range anywhere from $100 to $500 per month or more, depending on your plan. So next up is the copay. This is a small fee that you pay when you see a doctor or when you get a prescription. So, for example, you may pay $25 when you go see your primary care, or $10 whenever you get a prescription. Copays help you share the cost of your care with the insurance company. And then finally, we have the deductible. The deductible is the amount you're going to have to pay out of pocket for healthcare services before your insurance kicks in. So if you have a $1,000 deductible, you will first need to pay that before your insurance covers most of your bills. After that, you typically pay less in copays and coinsurance. Here's a tip. A higher premium usually means a lower deductible, and a lower premium usually means a higher deductible. It's all about finding the balance that works for you. Now let's talk about the different types of health insurance plans that are available. There's really two main categories: marketplace insurance and then government-funded insurance. Employer-sponsored health insurance or group health insurance is a health insurance provided by your employer. Most full-time jobs offer health insurance as a part of their benefits package, and typically it's more affordable than buying insurance on your own because your employer helps cover some of the costs. So then next we have marketplace health insurance or individual health insurance. And this is a health insurance you purchase through the health insurance marketplace when you don't get coverage through your employer or from some other source. And then we have the government-funded insurances like Medicaid and Medicare. Both Medicaid and Medicare have little to no cost whenever you qualify, but with both of them, you have to meet certain criteria. So we're going to link several different important websites down for you below, including kynect.ky.gov. That's a place where you can get insurance here in Kentucky. But in a nutshell, there's basically a variety of health insurance plans with different benefits and costs and coverage options. And the key is to choose the one that fits your needs, your health goals, and your budget. You don't have to be overwhelmed. Just take your time, compare options, and pick one that works the best for you. When choosing a health insurance plan, one thing you're really going to want to keep in mind is open enrollment. Open enrollment is that very special one time each year that you can apply or change your health insurance plan. It's like a special window of opportunity that opens and then it closes. Once it's over, you generally cannot make changes to your plan or enroll in a new one unless you have a qualifying life event like getting married or moving to a new state or having a baby. So it's important because if you miss it, you could end up without health insurance for the entire year. No one wants to be stuck with no coverage in case of an emergency, right? So with open enrollment, you can sign up for a new plan if you don't have one yet. You can switch plans if you're not happy with the current one that you have, and you can make changes to your current plan if your health needs or your financial situation has changed. So how do you actually choose the right health insurance plan for you? Well, it's all about understanding your own health needs and your budget. Here are a few questions that you want to ask yourself when you're looking at different plans. How often do I see a doctor? If you rarely go to the doctor, you may want a plan with a lower premium and a higher deductible. But if you have a condition that requires more regular care or more frequent visits, then a higher premium but a lower deductible might save you more money in the long run. So next, you need to ask yourself, what kind of coverage do I need? If you need prescriptions or mental health services or vision care, make sure those things are covered in the plan you're looking at. And then look closely at the network of doctors and hospitals too. If you have established care with a certain provider and you wish to keep them, make sure that they're in network and that your insurance will help cover those costs in order for you to see them. Next, you need to ask yourself, how much can I pay? Be realistic about what you can afford. Premiums are important, but don't forget about all those other out-of-pocket costs. Keep in mind, the cheaper plan may not always be the best deal if this means you'll end up paying more when you actually need care. So also, if you're still unsure, you can use the marketplace to compare different plans or talk to an expert. There are free resources available to help you navigate all of your options. All right, so here's a few quick tips to make your health insurance journey easier. Okay, 1, take advantage of open enrollment periods. If you miss it, you may not be able to get health insurance until the next year. 2, make sure you understand what's covered, especially if you have specific needs. 3, don't forget to check if your doctors and your pharmacies and prescriptions are in network to avoid extra costs. Health insurance doesn't have to be overwhelming, and now you know the basics of premiums and copays and deductibles, as well as how to choose the right plan for you. Your health is important, and having the right insurance is key to making sure you get the care that you need without the financial stress. So remember, health insurance is something you can manage. You've got this.